Our actions can change if we are alone or one rescuer is present or there are two rescuers present. Let's start from the adult BLS sequence when one rescuer is present. The rescuer who arrives at the site of a potential cardiac arrest victim should perform step 1 and 2 and then begin high-quality CPR. Step 1 is verifying scene safety, and we need to make sure that the scene is safe for you and the victim. We talked very thoroughly about this. Next, again we talked about this. This is step 2. We need to check for responsiveness and get help. We're asking, are you okay? Can you hear me? Can you answer me? Can you move? If the victim is not responsive, we should activate the emergency response system. Again, we talked about this, and we need to get the AED or send someone to do so. Next, we are assessing for breathing and pulse. You should do this at the same time, which we call simultaneously. We again discussed everything about this, and this should take no more than 10 seconds. Our next actions are based on whether breathing is normal and if a pulse is felt. If the victim is breathing normally and a pulse is felt, monitor the victim until emergency responders arrive. If the victim is not breathing normally but a pulse is felt, provide rescue breathing at a rate of 1 breath every 6 seconds or 10 breaths per minute. Once again, remember the numbers: 1 breath every 6 seconds or 10 breaths per minute. We need to check for a pulse about every 2 minutes. Perform high-quality CPR if you do not feel a pulse. If you suspect opioid use, give naloxone if available. If the victim is not breathing normally or is only gasping and has no pulse, begin high-quality CPR. High-quality CPR starts cycles of CPR with 30 chest compressions followed by 2 breaths. Remove bulky clothing from the victim's chest so that you can locate appropriate hand placement for compressions. And additionally, if you have AED, removing the clothing will also aid in more rapid AED pad placement. Use the AED as soon as it is available. If AED detects a shockable rhythm, give a shock, with all the rules that we discussed earlier. Give 1 shock and resume CPR immediately until prompted by the AED to allow a rhythm check about every 2 minutes. Continue CPR and using the AED until advanced life support providers take over or the victim begins to breathe, move, or otherwise react. If the AED detects a non-shockable rhythm, resume high-quality CPR. Again, until prompted by the AED to allow a rhythm check about every 2 minutes. If the AED analyzed first time and it says that the rhythm is non-shockable, it doesn't mean that after several minutes the rhythm will not be shockable. So we need to analyze every 2 minutes or listen what AED is saying. Continue CPR and using the AED until advanced life support providers take over or the victim begins to breathe, move, or otherwise react. Now let's talk about when there are 2 rescuers. The first rescuer who arrives at the site of the potential cardiac arrest victim should quickly perform the step 1 and step 2 and then begin high-quality CPR if needed. First step and second step is the same. Verify scene safety and check for responsiveness. We will tap the victim's shoulders and we will shout, "Hello, are you okay? Can you hear me? Can you move? Is there anything that you need?" Anything to ask to get a response. If the victim is not responsive, the first rescuer assesses the victim, and if no phone is available, sends the second rescuer to activate the emergency response system and retrieve the AED. Then for the first rescuer, the third step is starting, which is assess for breathing and pulse at the same time. Again, this should not take no more than 10 seconds, from 5 to 10 seconds. If the victim is breathing normally and a pulse is felt, monitor the victim. If the victim is not breathing normally but a pulse is felt, Provide rescue breathing at a rate of 1 breath every 6 seconds. We are talking about adult, okay? Adult BLS algorithm. Here, remember numbers for adult: 1 breath every 6 seconds or 10 breaths per minute. Check for pulse about every 2 minutes. Perform high-quality CPR if you do not feel a pulse. Again, if you suspect opioid use, give naloxone if available. If the victim is not breathing normally or is only gasping and has no pulse, remember gasping is not normal breathing. You may see that during your exam. Begin high-quality CPR. Once again, if the victim is not breathing normally or is only gasping and has no pulse, immediately do the following. One rescuer begins high-quality CPR starting with chest compressions. Do all the steps that we talked about: the chest compressions, the correct placement, the correct recoil, the correct depth, remove any bulky clothing, place the victim on the flat surface. We discussed everything earlier. Once the second rescuer returns and assists in providing 2 rescuer CPR, switch compressors frequently, about every 2 minutes or 5 cycles. 1 cycle is 30 compression and 2 breaths for adults. For adults, it doesn't matter if you are alone or there are 2 rescuers. The ratio is 30 to 2. Because we're going to talk about that it is different for infants and children, okay? Don't confuse together. For adults, it doesn't matter if you are 2 rescuers or you are alone. The ratio is 30 to 2. So 1 rescuer will do the compressions, and after 5 cycles, they will switch and the second rescuer will do the compressions. This helps ensure that compressor fatigue does not reduce the CPR quality. As my medical residency was in the ICU setting, I did a lot of chest compressions. I participated in a lot of CPR procedures. Believe me, it is not as easy as it looks like in the movies, in the videos, in the internet. It is very tiring. And not only you need to be physically prepared, even if you are very physically prepared, you have a big muscle mass, it doesn't matter. You can get very fatigued. Use the AED as soon as it is available. Listen what AED directions are, and if the rhythm is shockable, give a shock after clearing the patient. If not, continue and resume your CPR immediately, and until prompted by the AED to allow next rhythm check, which will be about every 2 minutes, and continue CPR until more advanced life support providers take over or the victim begins to breathe, move, or otherwise react. And again, if the AED says that the rhythm is non-shockable, we will continue again, resume the high-quality CPR and wait for the advanced providers or any reactions from the victim. I want to say one thing, maybe for medical providers, for doctors, for nurses, for any other medical specialties, maybe it is normal because we're learning anatomy, physiology, we know how heart is working. But maybe, for example, right now someone is listening to me who is bystander, just wants to learn how to give a first aid to someone who needs that. So heart is a muscle. It needs to be contracted so the blood inside of the heart will go to our organs and provide all the nutritions and oxygens and everything else. Heart has a very complex anatomy and histological and cross anatomy, and for heart to contract, the muscle is very unique. Heart has its own electrical generator, just to say in simple words. It generates there are specialized cells that generate these electrical impulses and then give it to muscles, and muscles listen and contract. So when we're saying AED is interfering with that electrical impulses. Also, when this electrical generator is not working normally, this is what the AED is eliminating. So it is eliminating this generator abnormal work, but it is not compressing the heart. What compresses the heart is chest compressions. So I want you to understand that the AED does not mean chest compression. So that's why we're saying after giving or not giving the shock, do the chest compression, because at that time when the analyzing happens and the AED gives a shock or talks by saying non-shockable rhythm, heart is not contracting, heart is not pumping blood, our organs do not get blood. So that's why this is very important. During your skill test, one of the checkpoints you will get is, does the rescuer after the AED gives a shock or detects a non-shockable rhythm continues and resumes as quickly as possible the chest compressions.